Welcome. We're going to talk about occupational therapy in the virtual environment. And I'm very excited to have with us today Sheela Ivlev to go over this with us. And the name of her practice is OT Bay Area. She is an occupational therapist and she practices telehealth. She also specializes in wellness and mental health because occupational therapists differ from other therapists in that they address both the physical and the emotional health. She helps individuals and professionals build resilience to manage the stress and demands of life and work to regain control of their health and well-being. She's committed to removing the barriers to care that keep people from accessing the wellness services that they deserve. So, Sheela, thank you so much for joining us. Really glad to have you with us today.
Thanks for having me.
You got it. And I like the thing you have behind you. Where's that from, by the way?
So I'm actually staying in a friend's home. So it I believe it's a an oar.
An oar. Okay, very cool
An
oar.
oar.
Heavy.
Yeah.
Excellent. Yeah, I like the decor. Um, so, if you could just share with us, just tell us a little bit about the services that you provide.
Sure. So I primarily work with adults, and I am providing fully virtual services right now. So I primarily work with people on their emotional health and wellness. And so I do individual sessions, I do small groups, and I also do corporate wellness. So in the time where we're all working from home, I do a lot of virtual ergonomic assessments.
Oh, okay. Excellent. So yeah, their emotional health, but also their physical health in terms of their
Mhm.
workspace, right?
Right, right. And I do have some clients that experience physical pain. I as an occupational therapist, we work with people through their lifespan from birth to death, and we work with people with various health conditions. In my practice, in particular, you don't have to have a diagnosis to work with me, but I do work with individuals that have physical disabilities or autism, as well as mental illness. So with the physical issues, I definitely address their day-to-day activities, ability to be independent or success that they choose to work on.
Yeah, and one thing that's new to me is occupational therapists helping with
Mm-hmm.
people's emotional health. But just saying that, I'm very aware of the need for that because when people have mobility issues or there's been drastic changes in their ability to do things physically, that could really cause an incredible emotional strain. They might feel like they're alone in it. Others don't understand, or they might be fighting against the healthcare system or not finding great solutions, or just those chronic issues of having to live day to day. So, if you could kind of share with us more about, just I guess inform us on about that in general, because I was unaware of it, that occupational therapists do that. So if you could maybe share about the need for that and how it is that they provide those services.
Sure. Obviously, working in mental health, I think most of us are aware of the statistics. So, one in five people in the States has a diagnosable a mental illness, but every single one of us has mental health. And so when you think of anyone that they have mental health, right? And so if they have additional issues, like you mentioned, if they have any difficulty with their mobility, if they have any medical conditions that affect their ability to engage in daily life activities that are important to them, then that definitely does negatively impact their mental health.
Yeah, and how do OT specialists, occupational therapists, how do they assist with people's emotional well-being, and is it part of their training, and is it a separate service, or is it something that they provide along with, what you'd consider, say, traditional OT services?
So The roots of occupational therapy are in mental health, but I'd say the traditional healthcare reimbursement, we tend to just focus more on physical disabilities. And so I was fortunate that in my training, I was placed in, psychiatric settings. And so I had that pure mental health background. And I also have experience in working with people in conditions as well. And so, the way that we break down what we do as occupational therapists is occupation to us is a meaningful activity. So if you think of anything that you engage in daily life, regardless of your age, whatever activity that you value, that brings you joy, that brings you meaning in your life, we address anything that is a barrier to you engaging in those activities. And so sometimes we will address, what's going on with somebody emotionally. If anxiety, for example, is a barrier in being able to work or form healthy relationships, or even, engage in basic self-care like hygiene, grooming, things like that. But also, you know, going back to medical conditions, something like pain
Yeah.
is impacting your day-to-day engagement in every activity, sometimes even sleep.
Mm.
And obviously, pain is, if you're experiencing physical pain, then that really does have a negative impact on all of your emotions, right? It's hard
Mm.
to feel joy. It's hard to feel peace. It's hard to feel calm when you're experiencing something like regular pain, for example. So, it's so broad scope. It's hard to it's hard to describe in just a minute or two. But really, if you think of um, any of your daily activities that have any meaning to you, that have any significance to you, that's what occupational therapists address. And so some of us have very specific mental health training and some of us don't, but those of us that don't have the very specific mental health formal training are actually addressing mental health just by bringing more meaning in people's life by allowing them to access the activities that are meaningful to them.
Wow. Yeah, that's great because it's so holistic. It's
Right.
yeah. Sorry that it's so new that this is new information for me and it's wonderful. Um, yeah, I really love that approach and being a therapist, I know that people struggling with anxiety and depression, a lot of
Mm-hmm.
emotional difficulties. It's because they're not doing well with the activities in their life that do bring that meaning and happiness, etc. And as they start to have emotional difficulties, it's like a spiral, downward spiral, because it negatively impacts even further those activities. Yeah, certainly.
Exactly.
Um, Now, in terms of working with organizations, I could really relate to that because I actually have chronic pain and it does impact my sleep every night, and I
Mm-hmm.
always have since I was a young kid. And so, like in my workspace here, I'm constantly making adjustments because it's hard to get it right. So, my chair that I'm sitting in has really good lumbar support. Not only does it have good lumbar support, I even add further lumbar support.
Right.
But then the arms adjust and the height adjusts, and then my monitor is on an arm that will adjust, and so and then the keyboard's on its own platform that could adjust. But then where I have my mouse is on a separate platform also, so my arm rests actually are slightly different, which I'm concerned
Mm,
about. But
right.
so yeah, like having all of that and then getting up periodically, not sitting too
Mm-hmm.
long. So like I feel all these things, right? Um, so and with people working in remote offices, working from home and not having those setups the way that they would, they're kind of like just shoved into it and they just kind of try
Right.
to scramble to find a space. So your work that you do is so vital right now. Can you tell us a little bit about maybe what's the process of helping someone with their workspace?
Sure. I start by finding out what their work routine is. That's something occupational therapists do. We analyze every activity and figure out where there are points where we can, do things to make it more efficient or more effective. And so with people working from home, I'm learning that some people are working 12 or 14 hours, way longer than they were working when they were in an office. And Right. And, telehealth, or not just telehealth, but what we're doing right now, people are Zooming. And so they are sitting longer, right? They're not getting up and going to a different office space. They're not going out to lunch with their coworkers. And so they are sitting in that one position for way longer than their body, can naturally tolerate. So I'm figuring out what they're currently doing. I have to see what the setup is like, and you adjust, right? I teach, and what I look at is you're trying to find the most neutral or anatomical body position, and so that you're not stressing out your body parts. You mentioned one side's a little higher than the other. Well, if you're doing that for long periods of time, you're going to start to feel it in your shoulders. You're going to feel it in your neck, even in your upper back. And so I assess what people's pain points are, and I adjust their workspace. You're actually doing all the adjusting, right? Because I'm on the other side of the screen. Make recommendations for equipment, or as an OT, I feel like we are MacGyvers. So things that we can find in your home to help you adjust if you don't have a budget to purchase any accessories or additional items. And then again, as an occupational therapist, because I am allowed to touch as an occupational therapist. Our licenses vary and OTs get to touch people, but I can't do that over telehealth. And so I will instruct on self stretches, self massages, depending on the areas that are impacted. So I'm adjusting the environment so that you're able to maintain a neutral body position. And then I'm also showing you how you can care for your body. So when you're on long calls, when you're on long Zoom meetings, I teach people how they can get some stretches in while they're still working, basically.
Yeah. So the way that you do it through telehealth is, I assume, through video, right? Like you have
Through
them use
video.
their camera to show you their home office setup, where they're sitting, how they're spending
Right,
time, how they're working, and then
right.
ask them about their pain points and their daily routine. Yeah, that makes sense. Um,
Yeah.
so some of the struggles that I'm assuming that you come across, well, first of all, you said that they're working a lot more hours. I hear that a lot.
Mm-hmm.
Um, and then emotionally, the percentage of people struggling with depression and anxiety is skyrocketed.
Right.
It's gone up like at least fourfold, I hear. Um, so you probably, I would assume, you see a lot more people struggling with that. They might not even be aware that they feel those things unless you ask them, though. Is that
Right.
part of your assessment? You ask them about their emotional state?
Yes, and especially with people that are working, a way that occupational therapists ask about people's lives is, again, we look at the things that are meaningful to you and how things might have shifted. So, are you spending less time on things that aren't work, on things that you prefer to do? Your preferred activities. Um, so. We do ask the traditional questions that mental health therapists might ask, but like you said, a lot of people aren't recognizing that they're experiencing more anxiety, or that they're experiencing some depression. And one thing that I build in, especially with people that are working from home, is boundaries, right? Finding ways that they can take care of themselves, but still be able to meet the needs of their employer. I find that a lot of people are just sitting during meetings, and you don't necessarily have to have, say, your video on, or if you're on a call, having people get up and move around, and people are
Right.
realizing, I don't need to just sit there.
Yeah.
People are forgetting to take breaks. There's the 20-20-20 rule. Every 20 minutes you want to look 20 feet away from your computer for 20 seconds. And people are realizing, oh, I'm
Yeah.
on my screen for hours.
So every 20 minutes, look away for 20 seconds.
every 20 minutes, look 20 feet away for 20 seconds. So you're giving your eyes a break.
Yeah, yeah, right. So, a couple things that I wonder if you wonder if you come across that people struggle with is making the purchase for equipment that will make a huge difference in their life. Like we'll spend, I see a lot of people, they'll spend like, a few $100s on a TV set,
Right.
but spending $150 on some office equipment that's going to be much more conducive, they might be resistant to do. Do you come across that struggle, make people making that, investment into their workspace, or no?
I typically find out, or not typically, I always find out what the budget is first.
Okay.
And I give people options. So, I prioritize if depending on what people's pain points are and what I'm able to observe, I know what's absolutely necessary. And so, I'll give a list and say, if you are only to buy one thing, this is it. This is going to save your back, your neck, whatever it is.
Okay.
And I find that providing that education is really important. People recognizing what musculoskeletal injuries are and what the long-term effects are.
Uh-huh.
So I work with some people who their work setup is causing so much pain they're not able to sleep at night.
Uh-huh.
And so people are able to see with minor adjustments how much that's helped. And so, you know, you can spend thousands of dollars on equipment, but I don't typically recommend that kind of equipment. So, I stick to things that are $50, $100 at the most. So most people are willing to make those investments because they recognize the changes in their body and how it's affecting their day-to-day life.
Yeah, yeah. I know some of these things don't cost much, like the arm that adjusts my screen. I think it cost me $15 or something, maybe $20. I don't know. It wasn't much. I was surprised how cheap it was. Maybe I'm wrong on that price, but I know I was surprised how much, like how little it cost me, and how much of a
Right.
difference it makes. Um, yeah, and then the accountability piece. So a lot of these things have been found to be really helpful, but I would imagine people staying accountable to themselves to implement. Is that something that is a challenge? Any tips for
Um,
that?
I Yeah, I'd say if anybody purchased equipment because it's all in demand, that's been the biggest issue, the delays.
Hmm. Yeah,
But
I mean, like
because
accountability for like doing the 2020 or getting
Oh,
up, or
yes. Well,
yeah.
I was going to say that the changes that people make to their workspaces has been consistent because they notice the difference right away.
Yeah.
Um, I do follow up, and for the most part, people forget some of some of the breaks, but there are apps for that. So when I follow up and I notice that, or I'm told that this has been a struggle, that's been a struggle, um, I remind them, just do it the next time, right? The next time that your reminder hits. So there are apps that you can use that'll remind you every 20 minutes, and you can cancel them. And if you're not consistent, there are some that you can't cancel after a few X's out. So
Nice.
there are tools, but it's like everyday life. It
Yeah.
it takes time, and it has to be worth it for you.
And with the apps, are you as the therapist able to get some reporting from the app in terms of their compliance with those activities?
I don't. I don't know if there are any that I can log into. It's just a third party app that there are a few different ones. So I try to give people options based on what they prefer. So,
Yeah.
things like singing bowls or, a cute image. But no, it's self-report.
Oh, okay. Yeah. But they can tell you, right? They get reporting on it,
Right,
and they can just tell you.
right,
So
right.
maybe you could tell us, in terms of the virtual office, people working from home, are there maybe three pointers? Like what are usually the three things that people need to adjust, or that would be most impactful for them?
Yeah. So what I find is that keyboard is too high.
Oh yeah, like having up, yeah. Okay.
Right. So my recommendation, so your shoulders should be down and neutral. You can see when people are working that their shoulders are shrugged up. So for most people, I recommend it's a $30 keyboard tray that's removable. It just sticks to your desk, and then your hands and your keyboard can be in a neutral position. I often find that the monitor is too far away.
Mhm.
So an easy way to measure out where your monitor is you want to reach your hands out, reach your fingertips, and your monitor, when you're sitting and working, your monitor should be right at the edge of your fingertips, that
Well, then
arm's distance away.
why not further away?
Depending on your vision, for most people, that's the right distance. If it's too far away, you're leaning forward.
Okay. If you feel like
Or
yeah,
you're putting your body in an awkward position to be able to see if it's too far
I see.
away.
Okay, yeah, yep, yeah,
And the third most common is the monitor's either too high or too low. And so you're looking up or your head is down, which is again putting a lot of strain on your neck and shoulders. So the top of your monitor should actually be eye level.
right, yeah, which is perfect for video conferencing because that's where the camera is.
Right, it is.
You gotta
Right.
be on eye level. Yeah, yeah, which is where I have mine right now, and that's one of the benefits of adjusting this thing. Yeah, that's very helpful. So, did you make the transition to seeing clients at the same location to doing telehealth, or was it always telehealth for you?
No, so I worked for the VA a few years back and I did telehealth, but I wasn't planning on doing telehealth. As an OT, we like seeing and touching people,
Right.
As I mentioned, a lot of what we do is interactive and hands-on. And
Yeah.
so because of shelter in place, I went virtual.
Oh, okay. Yeah. And how have your clients received that? Was it an easy transition for them and for you, or was it difficult? Do they like it? Do they not like it? What's that been like?
So some of my clients have not been able to do virtual just because of the nature of the work that I do and their access to the technology.
Mhm.
So I've gained new clients as well. And so depending on what we're working on, um, that technology is a beautiful thing that connects us, and sometimes it's an area of frustration.
Yeah.
I'm sure you've experienced this. I've had to teach some people how to use the technology.
Yeah.
Um, I've had I've had technical difficulties myself, or had clients that have had issues, which took up a good chunk of the session.
Right.
And some of the things that I mentioned that I would normally do hands-on, I've had to figure out how I could describe it clearly so that the other person can understand rather than just showing them. So some things take a lot more time to explain.
Right. Yeah. Yeah. Um, yeah, because you probably, like you're saying, you normally would just demonstrate it to them.
Hmm.
You're on site with them. Yeah. So do you probably have to, sit back from your camera so they can see, so you can demonstrate? Yeah.
Yeah, so my camera, I have a camera that's removable. So I move the camera around so that people can see very specific movements and body parts. I also, if I'm demonstrating exercises, I'll also send a recording so that people can see and make sure that they're able to do it properly.
Yeah, that's great. And you're probably doing more recordings now that you're doing telehealth than you were when it was all at the same location.
Yes, and I don't think I did recordings before. It's usually a handout because
Right.
you see them do it, you can show them how to do it. But there are a lot more challenges doing it virtually. I can only see so much. I can't see certain angles.
Right. Yeah. Do you have an assistant, like someone else in their house, maybe hold the camera for them or assist, or not? Not usually.
Um, Depending on the client, yes. I work with some clients that need assistance, and so those sessions involve family or caregivers. So I wouldn't necessarily say they're an assistant because really they're doing a lot of the work, right? They know my client better than I do, and they're with them in person. So yeah.
Yeah, that makes sense. So how are you taking care of yourself during this time? Because if everyone else is working more hours, you're
Right,
probably working more hours. You're probably not
right.
getting up as much. Um, yeah. So what are your self-care techniques and how are you managing?
Yeah, so I would say boundaries are definitely the hardest right now. So
Mhm.
I try to set boundaries and limits on how long I'm willing to work on my computer and, just put that away to spend time with my husband or get out of the house and walk the dog. Just making it a point, making it a point to get outside. Unfortunately, in California, it hasn't always been safe to go outside, but making sure that I am getting some fresh air every day because my work doesn't require me to leave the house.
Uh-huh. Right. Yeah, I could feel that like all of us, right? Uh,
Hmm.
yeah. So in terms of the services that you provide, is there like, a particular region where like would it just be those in California needing services that would be able to reach out to you for assistance or other states? And this is
Yes, I'm.
your website, which looks beautiful, by the way. Um,
Thank you.
yeah, and we could get into this, but yeah, what who is it that you assist?
I'm licensed in California, so I am a licensed provider and I only practice in California. So at this time, I can only work with people that are in California.
Hmm. Okay, all right, excellent. So if someone's in California and they need help for their remote office, their home office, or any wellness or OT assistance, they could reach out to you here at your private practice. And I really like how you have this banner at the very top to schedule a free virtual wellness check-in. So this is where you can book a session. Uh, it's just a form that you can fill out, makes it very easy. So yeah, it's I love your website. It's fantastic. Um,
Thank you.
actually,
Yeah, I wanted to make it a point to be as accessible as possible. All of us are struggling with the pandemic, so I didn't want cost or insurance to be a barrier. I'm open to anyone I'm licensed to cover to just set up a self-care plan to help people take themselves.
a lot of people need that. So even
Yeah.
helping people with virtual with their home offices, you would still have to be like you would still have to take into consideration licensure law, right? Because you would still be practicing,
Yes.
right? Yeah. Excellent.
Right.
Well, yeah. Well, thank you very much. This has been very helpful.